Good afternoon, everyone. Welcome back. I'm Dr. Srinivas Chilukuri. I'm a senior consultant radiation oncologist at Apollo Proton Cancer Center. On the occasion of World Kidney Cancer Day, let us all come together and learn a thing or two about kidney cancers. Kidneys are brownish red bean shaped organs in the abdomen, are key to many body functions. They ensure that we eliminate all the metabolic waste which is generated in the body. So it essentially filters out waste from our blood. It also makes sure that we maintain the blood pressure, the number of red blood cells, and maintains blood levels of several chemicals and even minerals. But unfortunately, as cancers can affect potentially any structure in the body, kidneys also could be affected with cancer. And we have learned from Dr. Raghavan that kidney cancers are indeed, fortunately, not very common, but we need to be aware of them. He also mentioned that blood in the urine is something which needs to be taken seriously, which needs to be brought to an attention of a doctor. It needs to be investigated. Also with us today is a prominent Uro Oncologist in the country, Dr. Ashwin Tamhankar, who is a senior Uro Oncologist at Apollo Hospitals, Navi Mumbai. Hi, Dr. Ashwin.
Good afternoon.
Good afternoon. So, Dr. Ashwin, we have learned from Dr. Raghavan that kidney cancers are fortunately not very common, but we need to be aware of them. And he told us about how to diagnose them and what are the common symptoms of kidney cancers. Dr. Ashwin, could you tell us who are the ones who are at risk of having a kidney cancers? Or rather, who should worry more about kidney cancers than everyone else?
Right. So obviously we call it, the term is risk factors. So basically there are three main risk factors which are proven as of yet for kidney cancers. Most importantly, smoking. Secondly, obesity, and thirdly, hypertension. I'll go one by one in details of each, why it is so, and how it is going to affect, or proportionately how much is the risk approximately by each factor. So smoking, obviously, we know that smoking is not good for majority of the body cells, and it's not just one kidney cancer, but there are many cancers in the body which are happening as a byproduct of smoking, or smoking is a risk factor for multifold cancers as well as some other diseases. So for under the uro-oncology umbrella, obviously kidney and the bladder. Bladder is more important. These are the two cancers which are relevant for smoking. So smoking obviously leads to byproducts which are excreted into the kidney, into the urinary system. For example, there are some certain agents called naphthylamines or phenylbenzenes. So these are the byproducts of smoking which are absorbed from the bloodstream through the lungs and then excreted into the urinary systems, and hence they cause mutagenesis. So smoking, generally the risk is proportionate to the amount of smoking, or is proportionate to the years of smoking. In technical terms, we call it pack years. So for example, one pack a day for a year will be called as one pack year. So the risk escalates massively after 10 to 20 pack years. And if beyond 40 pack years, the risk escalates to a very high extent. And for someone who is actively smoking now, if someone decides to quit smoking, for the risk to neutralize, or for that particular gentleman's risk or lady's risk to be equal to the person who is not smoking, it takes about 15-20 years. So it's never a late. It's more important to quit the smoking. Recently on 31st of May, we had no tobacco day, and the initiative from the WHO and the UICC was commit to quit. So that is one important thing which we learned today. Secondly, obesity is another risk factor for kidney cancers. Obesity again is relevant in majority of the cancers. If I can name those, say pancreas cancers, esophageal cancers, little bit about colorectal cancers, breast and postmenopausal breast and uterine cancers as well. So same stands true for kidney cancers. Why it happens? Because of the obesity, there is some inflammation which is going on in the body. We call it obesity related inflammation, which causes some cytokine. These are the elements in the blood. There are derangements in these cytokines. Secondly, obesity also leads to insulin resistance and a little bit of steroid pathway alterations. So these are the factors which contribute to any mutagenesis, and that is the reason why we have obesity as a risk factor of kidney cancer. The proportionate risk is not too high, but definitely higher than a person who is non-obese. Third most important factor is hypertension. So there are multiple studies which have variable outcomes and variable reports. I should say probably the risk varies between 1.4, we call it odds ratio in technical terms, but it goes from 1.4 to 3.2. So it can go very high as well. And there have been some studies which have found that probably one particular antihypertensive may have a potential role, but it is not proven beyond doubt. But most importantly, hypertension is a risk factor which is proven. So most important thing is control of a hypertension, which is relevant. If I can roughly quote a figure, roughly 10 milligram, 10 mmHg of increase in your systolic or a diastolic, that is the upper one and a lower one blood pressure, probably leads to, as in if you reduce it by 10 mmHg in a hypertensive individual, the risk reduces by 10% for systolic, and diastolic is 22%. So the lower blood pressure is very much important as well. And obviously your fitness, your exercise is going to act on your control of hypertension as well as obesity. So stay fit. That is one important thing which one can have. One quick add-on on this is, if you see these three factors, smoking, obesity, and hypertension, these are modifiable risk factors, meaning they are fairly under someone's control. Obesity, obviously, there are some genetic associations, but still in obese gentleman, if he's trying to stay fit, the obesity can be controlled. So these are all modifiable risk factors, and hence it is very important to understand the association of, or the etiology or etiopathogenesis of these factors to the kidney cancer. And age obviously is a non-modifiable risk factor. So age is another contributory factor for these kidney things. Last important factor for kidney cancer is patients who have gone to a end-stage renal disease, or who have chronic kidney disease, we call, where they are on a transplant or where they require regular dialysis. Probably these individuals have a little higher, probably I should say tenfold higher risk of having cancers in the native kidneys. Even if there is a transplant which has happened, patient is all normal, his native kidneys are prone to have kidney cancers, which is probably tenfold than a gentleman who doesn't have a transplant done. So that is one important thing which we need to understand about. And there is a small variant of kidney cancer. In technical terms, we call it upper tract TCC. Basically, it is a cancer coming from the lining of the ureter, or the lining of the urinary drainage pipe coming from the kidney. So there are certain risk factors, and that also has smoking as the most pivotal risk factor. And certain countries like Taiwan and all, where there is arsenic exposure in the water intake, they have higher propensity. And certain medications which have aristolochic acid, these are the drugs, or these are the herbal medicines which have little amount of increased propensity to cause these particular cancers.
So to summarize what you've just mentioned, there are three major risk factors which you've mentioned. And fortunately, the good news is that all of these three major factors can be modified. You can avoid smoking. You can not be a hypertensive by treating it. If you are hypertensive, if you are maintaining a healthy body weight, you can limit the risk for renal cancer, which is a good news for us. But Dr. Ashwin, is it more common in men or women? And do we have data from India to suggest that, well, these are the risk factors in Indian context?
So it is proportionately higher in men. So if we see the global literature, the proportion or the ratio is approximately 1.5 men as to 1 female. In India, there is a good data, in fact, coming from one of the prominent hospitals cancer hospitals in India. So it mentions that the incidence is higher in men in India. So the ratio is 4:1 in Indian standards. There is another one highlight to this. In that particular data, what we have seen is the global age or average age of incidence for kidney cancer in the globe is between 60 to 70, approximately 64. In India, it is nearly 56. So we are probably 8 years, or I should say a decade younger in diagnosis. Second most important factor is 40% of the cancers are diagnosed in an advanced setting in India. Third most important thing is nearly 1/3 of the patients are younger than 50 years, which is an alarming sign, I should say. And fourth most important data from that particular paper says that the male to female ratio is higher, 4:1. So obviously, we need to be more careful and more vigilant about it. We are much younger in incidence or much earlier in the diagnosis. as per the age, as well as we are at more advanced extreme of the disease when it is getting diagnosed.
So, Dr. Ashwin, can a young female, because you mentioned males are at a higher risk, so a young female who has never smoked, who is not hypertensive, who is not obese, who has not had exposure to the drugs and chemicals which you mentioned, uh, does she have a risk for kidney cancers?
So, though she doesn't have much of contributory risk factors per se immediately, but it doesn't mean that she may not have a kidney cancer. Like I said, there have been some reasons for there are some genetic implications which are also a part of etiogenesis of kidney cancer. So there are many genes. Probably I can add up to this. There are certain syndromes of kidney cancer which are familiar, which have familial association. So if I can name quick few things, obviously these are certain names which I'm quoting here, but there are many syndromic associations for kidney cancer. One is von Hippel-Lindau disease, and all these kidney risk factors have genetic implications. Second is tuberous sclerosis. Third one is familial associations of different types of kidney cancers, say papillary or leiomyomatosis associated cancers. So these are certain histological or pathological variations of kidney cancer, but they have genetic implications, meaning the genes are involved. If the genes are carried as an inherited property to a gentleman or a lady, and if at all, so generally what happens is a single gene is compromised, these particular diseases are going to manifest at later juncture because of some mutagenesis, environmental mutagenesis getting added to it. So it's a combination of inheritance plus environmental insults, which plays as an ultimate outcome, or which eventually leads to a carcinogenesis for kidney cancers. So most important thing here is, for example, if I can say these particular tumors, for example, just we can take an example of von Hippel-Lindau disease, where there is a kidney cancer as the main feature, but along with that, there are many other features, including some lesions in the brain, some lesions in the eyes or the retina, the posterior layer of the eye, some lesions in the ear, inner ear, pancreatic tumors, some sort of cysts in the kidneys. Similarly, other tumors will also have similar kind of features, including the tumors coming from the uterus, etc., or cysts in the lungs. So there are many factors which are associated. Again, coming to a variant of a kidney cancer which we discussed previously, for example, the upper tract TCC, which we discussed about, the cancer which comes from the lining of the ureter, there is a typical syndrome associated with that, in which there is association of colon cancer. So it can be a variegated pathology. That particular syndrome is called Lynch syndrome. So let's not get confused with the names. Probably the motto or the message which can give here is, it can be a syndromic association very well. And even if it is not a syndromic association, sporadically a particular kidney can very well be involved by a genetic association, even if she doesn't have a risk factor.
So, as to summarize what you just said, I think the risk factors are modifiable, the major ones are, but there are a small group of people who may carry certain genes who are at inherently higher risk for kidney cancers. And based on what you just said, we all know about breast cancer screening, we all have heard of colorectal cancer screening. We've also heard, we have heard about prostate cancer screening. But because we know all these risk factors, can these patients be subjected to some sort of a screening test to detect, or should we not?
So obviously, as per the recommendation, there hasn't been a screening test which is convincingly mentioned here. For understanding this in more detailed fashion, we should understand what screening means. So screening means we are trying to target healthy population,
Yes.
and we are trying to screen out a particular cancer or a particular disease out of those healthy individuals. So for a screening strategy to be robust, there has to be few criteria which needs to be satisfied by a small test which you're going to perform. So obviously the test has to be cost effective. It has to be a relatively non-invasive test, a simple test, and obviously the sensitivity or a pickup rate of that test needs to be higher. So for kidney cancer in general, the incidence is lesser than prostate cancer in gentlemen, or in ladies, it is lesser than the breast or the colorectal cancers in general. Obviously, it is not too less, but proportionately it is lesser. Secondly, small masses of less than 1 centimeter where they are forming as an early sort of cancers may not be very well picked up on ultrasounds. CT scan, which will be an investigation, will be probably an overkill if we decide as a screening modality. So most important thing is there is no robust screening modalities, but obviously there is a role which is coming up now for even head and neck cancers for high risk screening, which
Right.
Dr. Srinivas rightly mentioned. Probably if you are a candidate who understands that you are at a risk of kidney cancers by at least three risk factors. One is obviously four risk factors, you say age, smoking, hypertension, and obesity, then you should be very vigilant about it. Majority of the screening or majority of the health packages these days will include sonography of the abdomen or the tummy as a part of their standard screening, which generally rules out or generally picks up early types of kidney cancers. So we obviously don't have to chase it beyond that, but
Right.
no harm in getting those health checkups done on regular basis to keep yourself at a good health, and that can pick up early cancers, definitely.
So very well explained by you that screening is for normal people, and for normal people there is not a recommended test as of now to recommend everyone. But as you mentioned, those who have multiple risk factors could have a lower threshold and could undergo a simple test such as ultrasound, which is part of multiple master health checks, which could potentially detect an early kidney tumor or early kidney cancer. Thank you very much, Dr. Ashwin. I think it was very, very clear. The summary is that the risk factors are mainly three: obesity, the hypertension, and smoking. All these are modifiable, which is excellent news for everyone. So, if you are able to maintain a healthy diet, do proper exercise and physical activity to make sure that you're not hypertensive, you don't smoke, and you maintain a good weight, you have a limited risk of kidney cancer, which is great news for everyone. Thank you very much, Dr. Ashwin, for
Pleasure. Thank you.
joining. And we will see you all tomorrow with another expert and another set of few questions. Thank you very much.